Hi, today is November 8th, and I am going to talk about chordoma today. What is chordoma? So chordoma actually affects 1 in a million people. So approximately 300 people a year here in the States are diagnosed with it. Chordoma is a bone cancer that typically manifests itself in the spine. So anywhere between the base of your neck all the way to your butt. With that said, 60% of all chordomas are manifested at the base of the spine, so towards your glutes, and the other percent manifest themselves at the base of the skull. Andie's case manifested at the base of her skull. The theory currently of chordoma is that it is not a genetic type of cancer. However, there have been some cases where multiple family members do get diagnosed with chordoma. They expect chordoma manifests itself when some of the spinal cell tissues do not dissolve prior to birth. So this is something that someone could be living with their entire life and never actually have it manifest. Otherwise, it does manifest into chordoma. Chordoma typically affects men between the ages of 40 and 60. Andie is a female. She's Hispanic. And I say that because it typically impacts white males. And she was diagnosed at 28. So all very 1 in a million chances, literally. I think I provided a little bit of how Andie came to be diagnosed with chordoma and how scary it was. When she was finally diagnosed with it, we did approach Moffitt Cancer Center because it is a local oncology hospital here at the University of South Florida. The information for chordoma, because it is very rare, is somewhat outdated in a lot of hospitals. So the original way to treat this was going to be to break her jaw in half and go at the tumor through her mouth. Of course, this freaked everyone out because the side effects would be that her jaw would be broken and then have to be reattached. And the likelihood that she would lose the ability to eat or taste was very high. I'm not sure how we got to this. We were very lucky when we found Dr. Quinones. We also call him Dr. Q. He is legitimately the American dream. If I've already said this, then I am gonna say it again. If you are interested in his history and what he has gone through, you can see him on a Netflix documentary called The Surgeon's Cut. Again, not sure how we became so lucky or how we found him or stumbled on him. He is currently the head neurosurgeon at Mayo and worked for Johns Hopkins for 10 years. Andie has been in his care. She has gone and when she had the consult with him, he actually created a better system to treat chordomas that manifest at the base of the skull. So instead of having to go through and break her jaw, they go through the sinus and tackle the tumor. Prognosis for chordoma is typically 10 years. So when Andie discovered the Facebook groups and some of the survivors of chordoma, many of them went the older route, and a lot of them, because it manifests at the base of their spine, were able to prevent any type of damage to their face. Many people have lived past the 10-year prognosis, and some people have not. Andie specifically was diagnosed in 2019, so she's on year 5 with, as you all know, a reoccurring tumor. Treatment after surgeries and radiation, which is typically how they treat it. So surgery to remove as much tumor as they possibly can, and proton beam radiation specifically with chordoma to kill the rest of the cells or anything that is lingering within the body. Andie went through both of those things. She actually went through 5 surgeries. There were complications with being able to get her into proton beam radiation. And according to Dr. Q, Andie has one of the fastest growing chordoma cases he has ever seen. It is very aggressive, and he was very confident with proton beam because it was so aggressive that proton beam radiation was going to be just as aggressive fighting back. Again, I want to say thank you for everybody who has been very supportive. I know that we have not been very loud recently. There are many things going on here in the United States. And also, please do not forget to share. Sharing this really, really helps get the word out for Andie, for her husband, for her 3 kids. Please, you can find us on Facebook at Andie's Superhero FU Cancer. And there is the GoFundMe page on there. We have an Amazon link on there, as well as her Venmo. Anything that you can do to help really, really is appreciated. So hopefully I will see you guys soon. I'll give you a little more tidbit of Andie's journey and some updates with what is currently going on. With that, currently we are in kind of a lull until November 30th to see if radiation did help with her most recent tumor. So yeah. Thanks for keeping in touch. Remember to like and share as much as possible. If you can provide something, that's awesome. Her GoFundMe, her Linktree, everything like that is going to be on our Facebook page, which is Andie's Superheroes FU Cancer. Thanks. We'll see you soon.